Most common question I get is when we start these streams is, what is the music? Jeff Dismukes, my co-host on Wednesdays. Nocturnal, Ryan Welton. Okay. So, and you go, well, where have I heard that name? I mean, here's our erstwhile boss. I mean, the guy who makes all this happen across all these platforms, Ryan Welton. Featuring Chris Hicks, by the way. You can go to Ryan Welton Music on Facebook and see all of his stuff. And YouTube. You know, he's got a half a dozen platforms. But that's what it is. My first question out of the box today is that's not the name of that is Nocturnal. So you may have heard that before on some of our platforms, which he loans to us, courtesy of Ryan Welton Music. Jeff Dismukes, good to see you this evening.
Good to see you.
I would tell you that looking at the calendar right now, we got a great stream lined up. You've got a great stream lined up. 76 days until the primary election. And you know what they were doing at the Capitol today out there?
Yeah, well, they're lining up and signing up.
That's right. So coming from a family of those people, I've never understood that. I mean, just hats off, salute. So want to go do that in this atmosphere?
Oh, no kidding.
Oh.
I don't care where you land on the political spectrum, but it's anybody that's willing to step forward, put themselves out there and do this. Hats off. I applaud them for doing that. It's a tough job. Not a lot of people want it right now, but there's some really dedicated Oklahomans that are out there trying to make a difference.
Here. You have to bow you back, and just understand that at some point in the next few months, especially if you're a rookie and you're running for this, at some point you're going to say, I did not sign up for this. Okay. That's all you got to do is just get on to the. So also, which by the way means, as we've said, we'll keep track of this. That's 76 days until that election in Oklahoma County,
right?
For the bond issue on that jail.
Mm-hmm.
So we're going to talk a little criminal justice as we've promised. Every stream we do until that election, we're going to change a little bit tonight. One of the things the doc started talking about, the Fab Four, began to talk about months and months and months ago. That was prior to what was after. Right, we had the really nasty one. What was this last one we just had? The COVID strain.
Oh, geez. I don't know. I'm kind of losing track. Yeah.
Yeah. It's, the one in the middle was the super nasty one. And
we had Omicron and then something. Now we have
Omicron was the last one.
Yeah.
The one before was.
Oh, the one before it. I can't remember what the one before it was.
So anyway, it's bad news. And so we began to talk about other issues that were being delayed, not talked about, that we're going to have media attention. All the media can focus on was COVID, deservedly so. But there are other things affecting Oklahomans out there, and we want to start addressing some of those tonight, Mr. Dismukes.
Yes. I'm sorry we had a little bit of a crash here. I have a cat who's traumatized when I got home that just decided to knock everything over behind me. So I apologize for that. But we do have – there she went again. All right. I think we're good now. We have a couple of people in tonight. So at the bottom of the hour, we are going to talk about criminal justice issues with Tammy Wescott from the department, who's actually the director of criminal justice programs at the Oklahoma Department of Mental Health and Substance Abuse Services. She's a former assistant district attorney out of Tulsa, national expert on these issues. And as we've continued this discussion, I think it's a good opportunity to get a little deeper into the things that we brought up before. But we also kind of want to start off tonight talking about an issue. It's not a mental health issue. Although we talk about behavioral health here, this is not a behavioral health issue, but it's a really important issue. And I think anybody, when we talk about something that impacts 1 in 55 children, that's, as a parent, that raises our attention, and it's something really that is important to talk about and important to learn more about. And with us tonight, we have Emily Scott from the Autism Foundation of Oklahoma.
Hello, Emily. How are you?
Hey. Hi, guys.
Hi, Emily. It is Autism Acceptance Month, also Autism Awareness Month. Kind of an interchangeable term. I know it's changed recently, but knowing a little bit more about these issues, as I've learned more with friends and family, this is really an important topic in Oklahoma. And I realize that we haven't had a lot of discussion about this publicly. There are a lot of families in Oklahoma who are impacted, and a lot of families that that are looking for resources and ways to navigate this. So if we can start, let's talk about what is Autism Acceptance Month and what's the purpose?
Sure. So it's just to, bring attention to this. You gave that prevalence statistic, and it was actually just updated by the CDC, and it's now 1 in 44 children in the U.S. Are estimated to have this autism spectrum disorder. It's characterized by social skills challenges, repetitive behaviors, speech, and nonverbal communication. It's a growing population, and it's important to always have these issues at light, but we're happy, to have April and that time to really kind of focus on all the things that impact our community across the lifespan.
Right. Now, what do people really need to know about this, about the foundation, one, but also about autism, and again, going into a little bit more about the prevalence and the impact on families?
Sure. So AFO is a statewide organization. We serve autistic individuals across the lifespan. We have programs centered around advocacy, early childhood development, workforce development, and public safety, and also criminal justice reform. So we're really passionate about your discussion tonight. All of that information can be found on our website, autismfoundationok.org. And these programs really came from a major strategic planning sort of process that we went through in 2020, where we really engaged the statewide community, Oklahoma families, individuals, providers, and talk to them about what their needs are. And that's how we kind of focused on those program areas. So we're really proud to be offering supports in those important areas, including, as I said, criminal justice reform.
Well, how big of a factor is, so when I've talked about behavioral health issues, I'm talking often about stigma, I'm talking about parity and insurance coverage. How big are these issues within the autism community, and how much of a barrier is that for individuals?
Great question. I mean, it's huge. Nearly 3/4 of autistic children and adults have other co-occurring medical or psychiatric conditions. And we actually, unfortunately, have a really high suicide rate. Teens and young adults with ASD are 3 times more likely to attempt suicide. So it is a major issue, and COVID has just made it worse. So we are really trying to advocate in all spaces about the importance of the inclusion of autistic people in mental health services. It was one thing that we really focused on last week when we had our annual advocacy day at the Oklahoma State Capitol. We're really worried about our population. The isolation, the disruption in routine from the pandemic has really affected families.
So and you were talking about being at the Capitol from a policy perspective, what are some of the things that we need to see happen in Oklahoma and be aware of?
We definitely need to end that waiting list. We need more funding for providers. We have a major provider shortage in this state, kind of across the board, for autism service providers and mental health providers. So increasing funding, increasing pay of those critical workers would really help to sort of, kind of hinge that gap that we have. We know that families in rural communities are especially waiting a really long time to get services. So we talk to our legislators a lot about increasing that mental health support and increasing the funding for the waiting list.
Mm-hmm. So what are some of the major initiatives that you guys have planned right now, moving forward, not just for this month, but moving forward for the year?
So we're really excited to partner with the Developmental Disabilities Council in creating workplace training for employers to increase the ability for people with autism in our state to have work. So, I mean, we have the lowest unemployment rate, the highest unemployment rate of all disability categories. So AFO is getting into employer training so that we can help all of those state agencies and services that are out there that are trying to connect people with autism with services. We want to try to be on the other side of that and connect employers with autism education and resources.
And then, Oh, go ahead. Go ahead.
No. Oh, and then I was just going to say and in that criminal justice reform space, since that's what you guys are talking about tonight, we're really excited to have recently got a grant from the Oklahoma Bar Foundation to create training for judges, attorneys, justice system professionals. So that's really exciting and new that we're doing this year.
So talk about that a little bit with the criminal justice relationship there. And that was something that was brought up to me that really kind of caught me by surprise. Maybe tell us a little bit more of how that is, what kind of problem that is, and what we need to be doing to address it.
So yeah, I mean, I'm new to this problem too. I had no idea how pervasive it was, but the DOJ estimates that autism individuals are 5 times more likely to be incarcerated than people without disabilities. Mm-hmm. And Drexel University says that approximately 1 in 5 adults with ASD will interact with police before the age of 21. So it's a major issue for the community. There's usually a lot of misinterpretation of behaviors, and that can lead to criminal justice involvement. So we are trying to get into the court system and educate and advocate for individuals, try to get ahead of it, at a pre-trial level to help individuals and just the professionals serving them in these courts recognize the diagnosis.
So let's back up just a little bit with it also about signs and symptoms, and maybe talk about this. If I'm a parent and you're talking about services not necessarily being readily available, but is it also difficulty in the diagnosing phase as far as with working with medical providers? And are there challenges with this? What does that look like? What do these signs and symptoms look like? And what should parents kind of know about all of this?
Sure. So usually the call marks are usually challenges with social skills, repetitive behaviors, speech, and communication. There's a really great milestone checklist that I always encourage families to check out on the CDC's website. It's really comprehensive, and it lets families know what their child should be doing at each age. And they even have an app now where you can track all of that. And, if a child does seem to be off in their developmental milestones, we really encourage families to seek out services like Sooner Start and also their local school district, who can do sort of baseline screenings and make recommendations for whether children should be moved on to the diagnostic phase. Unfortunately, as I talked about earlier with that provider shortage, it does take a long time to get that medical diagnosis. So that's why we encourage families to at least get that screening, because they're able to access free and appropriate services through their local school district and their local Sooner Start office until at least that child, is school age. So, and get on those waiting lists. But unfortunately, it has taken about 1.5 years is what we're hearing to get the medical diagnosis.
Oh my gosh. And so are there difficulties also just within the medical field? Is there more need for awareness of recognizing signs and symptoms earlier, more training needed for physicians?
Yeah, I think so. I met with a group of up-and-coming clinicians today with OU Health Sciences, and they were telling me, they're in school right now and they're receiving a limited knowledge of autism. Right. And I thought that was really interesting because they were going into autism specific fields like occupational therapy and speech and language. So, we are often reached out to by healthcare providers to, provide that sort of education and any resources and tools that we have. So we recently created sensory kits for professionals who are serving people with autism. And so we're able to offer those so they can better serve. They have things like noise canceling headphones and weighted blankets. They're available on our website, but those are really helping in those spaces of healthcare, but also in public safety.
So it seems odd to me that, this is such an issue that is of such importance in Oklahoma and nationally, yet we still don't seem to be really on top of it in what we're doing from a training standpoint and education of our workforce. And I'm not trying to call out the medical workforce on this. There's certainly plenty of challenges that are out there, but it is an issue that I often talk about with behavioral health issues also. And so I see some similarities there and some of the struggles. I've been around this. I haven't been around or aware of the issue all my life. It's only been in recent years, but I've heard the families and talking about the struggles and the difficulty that they've experienced. And I don't think these are families that have been quiet about this. It seems like we've had a voice out there in this area for some time. I know it has to be extremely frustrating to not see progress come at a rate that we want to. But are we making progress? Is this something that we're moving forward on, even if it's not fast enough? And how much faster do we need to go?
So we are. I mean, we are making a movement. I've been a longtime advocate in the community. So my son is 19. He's on the autism spectrum, and I've been involved in policy advocacy pretty much since he was diagnosed at the age of 3. And I think, in 2016, it was a really big deal for Oklahoma to pass autism insurance reform. And now we have seen all of that kind of fall into place. So now families are able to access, therapies through sooner care and also through health choice and just pretty much all the plans now. And that's really made a big difference. So I do applaud our legislature for coming along on that and helping out families. And we do see, because the prevalence has grown so much. I mean, for example, when my son was diagnosed 16 years ago, it was 1 in 150, and now it's 1 in 44. So we are seeing a major awareness happen. And we had like a lot of great legislative buy-in when we had our annual advocacy day. We're seeing legislators come out about their family ties to the diagnosis, how they're connected, and we're seeing them really kind of advocate because they're touched by it personally. And I think that is really making a difference in the state.
So obviously the foundation, I want to talk again about the foundation, make sure before we get you off that people know how to connect the foundation. But what are the resources that are really out there for families? What are you telling people that they need to do as far as helping to find ways for them to deal with this successfully? And let's talk a little bit about inclusion real quick before we get off, and the importance of inclusion and awareness about that within everything that we do within society, schools and work. And you already mentioned work and the different opportunities that we have there.
So inclusion is the backbone of everything we do. I mean, from, the early childhood development to the workforce development, that is really all inclusion efforts that we're trying to make happen in this state and progress along like we see maybe in other states. I know that Oklahoma has that ability, and it's just a matter of educating. And so we want to be that. We want to be capacity builders. We want to help people where they're at. And then, for your first question about families, I would just say you're not alone. You're definitely not alone. Reach out, whether it be us or any other autism organization in your community. We really encourage families to get involved, find their tribe. There's a lot of wonderful organizations out there. Although we do offer a lot of professional development and training, there's other organizations that are like Autism Oklahoma that's offering a lot of family support and sort of social activities for kids, and they're doing a lot of work in teens, which I love to see. So there are a lot of autism organizations. I think there's like 6 of us now. So I would just encourage, families to connect.
Yeah, I think it's important. I'm hoping that we're moving towards a place to where we can start to learn to celebrate differences.
Absolutely.
We've that's something we talk a lot in the behavioral health field, and I've been involved in different things over the years. I do think people become quiet when something is scary to them. It's almost like we don't want to talk about it. I remember, so I'm old enough to remember back when we used to whisper about cancer. And I remember hearing my parents talking about so-and-so had cancer, and their voices would be real low. And it was like, if you mention it out loud, it's going to do something. I don't know what it was going to do.
Be real. Yeah.
And so I think it seems from my perspective and looking from the outside that we're kind of the same place here when we're talking about autism. Sometimes people are afraid to talk about it, afraid to ask questions, and worry a little bit about the difference. The difference seems to be scary to everybody, but actually it seems to me that differences make people very unique. and it's something that we should celebrate. Is that correct?
Absolutely. And I think that's why you see, people moving more towards Autism Acceptance Month. It's the differences about us that make us unique and special. And it's really about embracing that. And I have to applaud the adult autistic community for coming a long ways in that advocacy towards acceptance of neurodiversity. So yes, that's really important. And I love that is happening in the behavioral health field.
Yeah, so I'm going to ask you another question. So I'm going to bring in my own personal theory into a couple of things. I also see stigma that I think, thinking of the issues that I work on with behavioral health, I seem to see stigma that's within the community also, that we tend to be, I think sometimes because of the limitations that we've had with services in the past and what we've had to learn to accept, that it sometimes stops us from moving forward and seeing the world differently and evolving in our views on the thing that's most important to us and that we're talking about. Do you see the same challenges with autism? Is there a place to where maybe things haven't moved along because people have become so used to this is all that we have and this is what we have to do, and maybe not seeing the other possibilities? Is that a roadblock? Is that something we all need to be aware of?
Sure. And credit where credit's due. We are seeing a lot of improvement in this area, but for a long time in this state, I think that there was kind of lines drawn in the sand between autism and mental health, because one is considered a developmental disability and one is mental health, but really there is so many. I mean, the statistics, the evidence show the co-occurring conditions happen. It's so prevalent. 3/4 of the population. And so I would just encourage professionals to not fixate on that label, but really meet individuals and families where they're at and treat what's happening, in real time, because that suicide statistic is something that should keep all of us up at night. And so I just don't want people to lose focus on the bigger picture, and that's getting a person help. We are seeing some improvement, and I just want to, encourage that to continue because it's a major issue for our community.
Once again, how do people contact the foundation?
Sure. So our website is autismfoundationok.org. And I would encourage people to check out our Facebook page because we have a lot of upcoming community events that we're going to have in April because of Autism Acceptance Month, but just all throughout the summer with our different partners. So please, like the page and check out our events. And as I said, get connected. You are not alone. You do have a tribe out there, and we want to just, connect families and help them out.
Tell you what, we'll see if Scott wants to come back in real quick. There he is.
No, I was enjoying the conversation. I will say, Emily, one of the things that I was noticing was your conversation about the law enforcement. Speaker's going to speak on that, and then the deal we recorded earlier. But there's also, we've been talking about the waiting list since Roosevelt was president. And so,
let's say dawn of time. Yeah.
And so it's just been one of those things. There was a excellent story today in Non-Doc. I think Matt Patterson wrote the story today. We talk a lot about Non-Doc because Trey Savage and his people do such a great job. And they are, nobody touches them. They're just that good. So great story about Matt Patterson. It's long, detailed. It's not 90 seconds. It takes a while to read it. So Emily, you've seen that story. It gives great detail. There's also some things part of the story that are not good about a data breach. My head was exploding while I was reading all this, but I remember when we were doing live shots from the Capitol 5 or 6 years ago, we were talking about the waiting list, and we've been hearing it's going to be taken care of. It's going to be taken care of. It ain't. It's just not. And the families that are on it, Emily, it's just awful.
Yep. I'm one of those families. I am, my son is on the waiting list, and we were impacted by that data breach. It's a major issue for sure. and we need to take care of it. I think one of the hardest phone calls I get at the foundation is new families who've come to Oklahoma, and they're calling and they're wanting to get connected to services, and we have to break the news that those community waivers are not available to them like their state that they came from, and like they are in most states. So we do have to do a better job. These kids need services, and we truly believe that whenever those services are made available, not only does it increase the quality of life of the child or the parent, but it's going to take a long-term burden off of the system if we're providing those interventions and those assistance early on. And so we need to do, it's just doing the right thing. We need to take care of that waiting list.
Okay, well, your hands are full over there.
Yeah. But, it's a passion. I love what I do. It started out with advocating for my son, but now I just feel like they're all my kids and all my friends in the adult community, and it's a labor of love.
Well, we can see that. And thanks so much for what you do. Thanks for being on tonight. And
Sure.
I hope this is the first of many discussions we get to have with you.
Oh, I'd love that. Thank you, guys. I appreciate it.
Thank
Thank
you.
you.
A good one.
Okay, well, it's a great job by both of
Fascinating
you. I
topic.
learned a lot. I learned a whole lot there. And at the end of the day, there's still work has to be done. And, it's not only is she working on behalf of those 5,000 families on that waiting list, she's one of them.
Yeah. Isn't that amazing?
It is amazing.
Incredible. The people in Oklahoma are doing so many incredible things, and we don't hear enough about them.
Well, you got that right. The bad news seems to lead, right?
Yeah.
We understand how that works, but
Right.
people like Emily who are doing God's work on these things, well, it's great. Thanks for arranging that interview, and we hope she comes back again.
Mhm.
We're going to be talking about criminal justice reform and a lot of great things with our next, starting to sound like a former president, a lot of great things. Sorry. 76 days into that bond election, and the issue we're talking about is that jail, but there's a lot of things behind these, not just on that jail, but some others. And as what I mentioned earlier, usually on Mondays, we do the speaker's exclusive interview. Well, I'm sure we're going to be doing this again next Wednesday at some point. There's quite a bit of action that I would tell people are going to be happening next week. That hasn't broken yet. There's some big news coming next week. And a couple of my sources tell me really big. As Joe Biden would say, big. Well, I can't say exactly.
But is it really big deal?
Yeah, big deal. So we'll be talking about that. So it's filing day. This is our exclusive interview, which as we keep it under 10 minutes. I think it's under 8 minutes tonight with Speaker McCall. This is this afternoon talking about, ironically, talking about law enforcement and also filing in here. That is. Good afternoon, Mr. Speaker. Good to see you again. Have you filed?
You bet, Scott. First thing this morning.
It's a lot of people out there lining up at the Capitol. So, you're going to be, it looks by if you look at the prognostications, and they're pretty good, you'll be the speaker again for a fourth consecutive term. We've talked about that in the past. What is your outlook right now in terms of members of your caucus and how that's going to turn out this fall?
Well, we only have 5 members of the Republican majority caucus in the House that are terming out. There's 1 Democratic member that has reached her term limit. So a total of 6 seats in the House of Representatives have opened up due to term limits. There's always some members that decide not to run last minute. There are members that decide to run for other seats that have opened up. And we certainly have seen that with the retirement of Jim Inhofe, our senior U.S. Senator here in Oklahoma, which has opened up a congressional seat, CD2, with Congressman Mark Wayne Mullen vacating to go run for U.S. Senate. So we've seen some House members that are expected to file for that, and some other offices. So it'll be a big election cycle this year for the state, with all the statewide up for re-election. In the House, we'll see if there's any surprises Friday at 5:00, but we'll have certainty at that point in time, and looking forward to seeing what the election cycle looks like for the state of Oklahoma. But more specifically, in terms of my interests are just in the House of Representatives.
Understand that. Now, I suppose that, it hasn't always been this way. Used to primaries were at the end of August or early in August, and now they're in June. How does that factor into how you're trying to get the people's business done so far in this legislative session and facing an election, a primary election? Not too well. It's end of June, but that's pretty soon after Sine Die.
Yeah, Scott's a great question, and it is a logistical challenge for office holders. And the Constitution says that we'll be in session the first Monday of February of each year, and we have to adjourn by the last Friday in May. So after filing, if there are members that have challenges with those in primary challenges, they just have a few months to get ready for those, and they're going to have to do that while they are completing the people's work here at the Capitol. The budget will quickly become the focal point, and it this time of year, as it does even when it's not an election year, and policy will finalize through the process as well. And we always we always kind of target mid-May to wrap up session. You never want to go that. I hate to go to the very last day, but it's there if we need to. But I think the election years always kind of add a different nuance, wrinkle, and dynamic to the legislative session. And typically after this week, there will be, once again, as last year, you'll focus in on where the policy priorities are between the House, the Senate, and the governor, and on those budget items, and finish the process out to bring close to the 58th legislature. But I fully expect that we're going to be here, another 4 or 5 weeks.
One of the things that's not being covered much out there are a lot of things going on, of course, is law enforcement. We know where this has been. It's been a political volleyball for the last few years. Mm-hmm. What is happening right now with the Republican caucus and you as the speaker? Where are we headed with legislation dealing with law enforcement in this session?
Hey, Scott, thanks for the question. This is an area that's very important to House Republican caucus and has been for years. We're always looking for ways to support law enforcement across the state. We back the blue every time. We appreciate their service to the state of Oklahoma. They put their lives on the line every day for the citizens of the state of Oklahoma. We know their jobs are difficult. We know it's a calling and it's a passion of theirs to fulfill that mission and that job, and we're going to continue to be supportive. I think we're very interested this year, and there's been talks pre-session about additional funding for law enforcement this year. And once again, in addition to the previous years, we're really focused on raising the top law enforcement agency of the state, the Oklahoma Highway Patrol. We're not as competitive in the region on that pay as I think we need to be. We're seeing we've seen some early retirements and those who are eligible for retirement exiting. We need to build the pipeline for additional law enforcement resources at the state level. There are other law enforcement agencies very important to the state. We believe by addressing Oklahoma Highway Patrol, the rest of all law enforcement at the state level and even at the local level will all have upward mobility in pay along the way. But we're going to continue to support them in the budget, and we're going to continue to pass legislation that protects them and allows them to do their job, keeping the peace and the safety here in the state of Oklahoma.
Now, there's been quite a bit of legislations passed off the House floor and gone to different places. There's also been, the media does like to talk about, through the discussion, about defunding police. It's happened. It was really, really talked about a couple of years ago. Is that still on the agenda for some folks at the Capitol right now?
Oh, I think that was absolutely not. And I'll say it again. There's only third world countries defund their police. I mean, and it was moronic for other states and national groups to suggest that was a solution for anything. That's a solution for chaos, not public safety. And the people of Oklahoma don't buy that for a second. That was found to be politically unfavorable, and the left that was embracing that type of message has completely abandoned that, and you're actually seen some people defeated over that in the state of Oklahoma. So it's once again, that is a terrible. That's bad policy, and that's terrible politics. So Oklahoma will stay on the path. Its current leadership in the state, in both the House and the Senate, will stay in the vein of supporting law enforcement in the state and providing safety and protection for the public here in this state.
Last question. The week is getting pretty short, but then it's a deadline. Anything that's really under the radar that's really important to Oklahomans?
I think there's a lot of opportunity in this state, and it's really, I think the people of the state of Oklahoma will see some tremendous opportunities that we've not had in the past that will surface in the next few weeks. That the legislature will be able to just, it just has really the pleasure to discuss and decide, if these opportunities are great for Oklahoma. But nevertheless, we are seeing things in the state of Oklahoma that we can talk about. Once upon a time, they may have been dreams and visions about where we could go and what opportunities might arise. But we're actually seeing some of those things actually present themselves, and we're going to have the opportunity to talk about those and discuss them and vet them and hopefully do some really incredible historic things for the state of Oklahoma. Whether those I think our leaders here at the state are very eager to embrace those things and discuss them.
If that tease doesn't get people to start following your podcast, I don't know what would. That's kind of like, stay tuned, right?
That's right. Yes. I'm excited about the opportunities to finish up this session with some really unique opportunities for the people of the state of Oklahoma.
Okay. Well, we're going to keep watching that. Mr. Speaker, thanks for your time today. We'll see you next week.
Thank you, Scott. See you next week.
Okay. I don't know what a better tease could be.
Right.
So there's been a lot of discussion, and by the way, we're going to get to Tammy Wescott in just a moment, who has been patiently waiting back in our green room. Do we have snacks and drinks in the green room here? I'm not really sure we do.
Not sure.
But anyway, what I think the speaker is talking about is we've been hearing about this project that is being pursued by state leaders, which is again, what the former vice president said, a really big deal. And we've had I thought it was going to be announced more recently, but I don't know. I mean, I know there's some big deals underway. And listen, no matter what your politics are in some of these, when you start talking about bringing big jobs, and especially jobs perhaps with renewables, we look into the next economy. It's just amazing sort of thing. So anyway, I was asked, should we do something early in the week for my next interview with the speaker? And a couple of his guys said to me, you should probably wait till later in the week. Okay. If that's not a hint, I don't know what.
Yeah.
So, okay. So the Speaker McCall appears here either on Monday or Wednesday nights on Mitchell Talks. Only here. We're the only ones that get an exclusive interview with the speaker. So always appreciate him. All right. We're saving the best for last now, right?
That's right. We got Tammy Westcott coming on with us. We're going to talk. So we've been talking criminal justice forever. We've had several conversations. It has been me primarily talking about it. So I thought it might be important to get somebody on who actually knows what they're talking about.
Tammy,
and that's
welcome.
Good evening.
That's Tammy. And I think the speaker he talked about in his interview. He was talking about law enforcement, certainly an importance on law enforcement. We work with law enforcement and behavioral health. Have been tremendous partners, but there are also a lot of other discussions going on. There are discussions with the jail. So in Oklahoma County Jail, there's been a lot of discussions around that, the new jail facility. And you have advocates on one side talking about, well, we need to pull money from this and put over here into some other areas. I always wonder why we just don't fund everything where we need to fund everything, and quit worrying about tearing down too much, because the jails have a function in our society. Certainly we talk about that in the criminal justice system and behavioral health, and have been very innovative in finding ways to engage there, because there are too many people who are engaged with the criminal justice system simply because of untreated mental illness and addiction. And we have opportunity to divert those individuals from incarceration and provide treatment. And we have really successful outcomes. So Tammy, with that, let's talk about, when we're talking about the criminal justice system and the impact of behavioral health issues on the criminal justice system, what is it that we're really talking about?
Well, Jeff, it's a wide spectrum. We have people with mental health issues, we have people with substance use disorder, and then we have people that are co-occurring. And what we try to do is meet everyone at where they're at with the offense that they have. So, of course, we've had drug courts for a long time for those with substance use disorder, but those are limited to felony offenders. And so when 780 and 781 changed, the severity of that crime of possession to misdemeanor, of course, we had to regroup and make sure that those people are still getting treated, which is a huge, big new initiative for us. But I think the key here is we have made such effort to try to assess people right when they're put into a jail. Now, right now it's felony offenders, according to statute 43A 3-704. We have the responsibility to do what we call an offender screening. And that is done by certified treatment providers that use a validated screening tool. And what they do is they assess for substance use disorder, mental illness, or risk assessment. And their whole goal is to identify those with mental illness and substance use disorder so that as quickly as possible, we can get them to the right program that will best meet their needs for long-term wellness, well, long-term wholeness, that they stop going through that revolving door of the criminal justice system. And I'm happy to report that at the end of FY21, we had 47,690 offenders screened, and 82% of them got a case disposition other than prison. So it's helping to inform judges, prosecutors, defense counsel of saying, hey, this person has treatment needs. And if we can treat those needs, they will be better served than putting them in a period of incarceration. So that's proved very successful.
And, and I've talked a lot about the screening services and the tool that is out there. How is it being utilized right now within the state? As far as, is everyone taking advantage of it? Do we have room for growth? Obviously, it's a successful tool. We've been able to successfully divert individuals. And I'll ask you another question off that. Let me go ahead and let you answer the first one I gave you.
Yeah, give me one at a time, please.
Yeah, I'm bad about stacking.
Yeah, no worries. I'll stay with you. So I'm sorry to report that we don't have the use that we would love to see of the offender screening reports. Defense counsel, judges, and prosecutors have access to those. The offender screening reports can be sent to them. And the goal is that judges and prosecutors and defense counsel would take that, and because it's got recommendations on it, based upon the scores. Again, these are by certified treatment providers, and they're validated to the criminal justice population. It takes those scores and it says, based upon what we see here, the best program for this person, or the best diversion, may be early diversion program. It may be drug court. It may be mental health court. And it may just be probation, right? If they aren't in need of treatment, we certainly don't want to overtreat them. We want to give them the best option possible. And so that the offender screening report makes recommendations about what program might be best. We could use a lot more diligence in all of our courts to take those reports and say, wait, why are we pleading this person to 60 days in jail when they have mental illness and there's something that would serve them much better? Why are we pleading them to prison when obviously they're in need of treatment, and that would have better long-term effects. So we really do need those in the criminal justice system to pay more attention and to make better use of those screening tools.
So, Tammy, you're a former prosecutor, and and I would imagine you've seen this work firsthand.
Absolutely. Absolutely. I started out right out of law school on the felony team, and I was doing jury trials within being sworn in 4 months later. I was in jury trials, which was a little scary, but I enjoyed that part of it. And I understand the need there are some people who don't need to be in the community, right? That's what prisons are for. You protect public safety, and that's the role of a prosecutor. So I understood that role. But then when I had the chance to go to the alternative courts, it took me a little bit, I'll be honest, because it's a paradigm shift. It's not adversarial anymore. It's a whole team coming together. You work with the judge, the defense counsel, the treatment providers, the coordinator, the case managers, the judge. Everybody comes together, which is not normal in the criminal justice system, right? It's usually adversarial. So everybody comes together for the good of these people who are in the program. And what I saw over and over and over again in multiple graduations, multiple changed lives, was that the judicial arm connected with treatment was highly effective, because it was kind of that extra motivation to stay in treatment because you were ordered by the court to follow the treatment plan that was developed for you. And then there was all the wraparound services, help with housing, help with transportation, help with getting a better job. And I saw over and over and over again lives changed that I truly believe many of them would have been worse after a period of incarceration because they wouldn't have had the proper treatment. They probably would have lost the job, all of those other things that caused their life to spiral in a bad way. And so I saw it work. I saw people have long-term sobriety. I saw them get jobs, get their children back, have stable housing, and not come back through the criminal justice system. And our recidivism rates prove that.
Right. That I often talk about not just the lives changed with this, but hey, we're in government and we have to talk about this. There's a cost savings to the state when we see that. It's been significant. Just in general with treatment courts, and we'll focus there for just a second. In general with the treatment courts, what statistics really jump out at you that kind of show that they work?
Well, there's several statistics. First of all, it last I knew, and I'm not sure how up to date these are, but the last I knew, it cost about $5,000 per year for the state to provide the services through a treatment court program to an offender, versus a year in incarceration is about $19,000. So for each person, you're looking at a savings of $14,000 a year. My latest figures showed that we had about 2,800, give or take, in our drug courts across the state. So multiply 2,800 by cost savings of $14,000 per year. I can't do that math in my head, but it's significant. And then, of course, there is the cost savings long term of no recidivism. Less recidivism means less cost in the criminal justice system, less incarceration. And Jeff, I think a really great point is what people don't sometimes think about, and what we can probably never measure, is the ripple effect. Children of incarcerated parents are much more likely to get in the criminal justice system themselves. So if we can keep parents out of incarceration, there's a better chance that their children won't end up in incarceration. That's another cost savings. And then something else I don't think we think about often is we turn someone who may have spent 3, 4, 5, however many years, 10 in incarceration, and after they leave the program, most of them have jobs and become taxpayers. So there's a net benefit there as well. And I don't think anybody has ever calculated the immense impact that all of these programs can have, not only on individual lives and on families, but on our state for public safety and for cost savings.
And we aren't just talking about the treatment courts, are we? I mean, there are other, certainly there's been changes, and I hear a lot. I get a lot of questions about 780, 781 and the impact on the system, but there are a lot of other options that are out there and resources that you're able to provide with the courts. When I've talked to you, there's several innovative things that you're talking about in designing programs and being a resource for those courts. Can you speak to that for just a second?
Sure, absolutely. One of the things I'm most excited about is redoing how we used to work with the misdemeanor population. All of our drug possession offenses now are misdemeanors. And then there's people that have misdemeanor offenses that are in need of some sort of case management services, or they have a mental illness and they need treatment. And so what we have been working on is revamping, kind of used to be a mini drug court, like a misdemeanor drug court. The problem with that was, how do you get someone who's charged with a misdemeanor, doesn't have that much, has some legal benefit, but not as much as a felony, to go to testing, go to court, and do all the things that a drug court requires? It doesn't work. Tulsa is a great example of shutting down what termed was their misdemeanor drug court, and I take full responsibility. I kind of helped start that when I was in Tulsa, and it didn't work because it was a misdemeanor drug court. And the year before they shut it down, they had 17 participants and 14 failed. I'm happy to report that after revamping the misdemeanor program, Tulsa is now running over 200 participants in their early diversion misdemeanor program. They're getting wraparound services. They're engaging with treatment, all based upon a model of let us help you. Let us help you to, what do you need? Transportation? Do you need food? Do you need a better job? Do you need treatment? We're here for you. We can provide treatment. And Jeff, since I've got some figures here, since February of last year, February of 21, we had about 614 individuals across the state in what we called our early diversion or misdemeanor diversion programs. As of January of 22, we had 1,169, a 90% increase in enrollment in 1 year. And that is because I believe we're approaching it in the right way now. We're approaching it in the way of just engage. Can we just get you connected with community services, with treatment? And if you'll engage, the prosecutors are dismissing their case or giving them no jail time or dismissing fines and costs. And so we have the DAs on our side as well, which is key, right? They have to give them a benefit, and they give them a benefit, and then people engage in the services and their lives are changed for the good. And so we're very excited about expanding that. I believe we have 25 counties now that are doing early diversion. My goal is to get every county to have an early diversion, so those with mental illness or substance use disorder can get served in every county that are misdemeanors.
Hey, Scott, one of the things that we were talking about, I believe last week, we were talking about populations in the jail. And I've kind of been concerned just a little bit about we do talk a lot about mental health, and it's important that we talk about that with jail populations. But I worry that people are thinking that everybody in the jail is there because they of a mental illness. Tammy, that's different. I think when we point back to the screening, we talked about 80% of the people being diverted. We need to remember that 20% of the people aren't being diverted into any type of diversionary option. And well, that's because there are people that need to be in jail. And I think that we see that not everybody in jail is necessarily going to benefit from treatment as far as opposed to their sentence. Is that correct?
Yeah, absolutely. First of all, by statute, there's several charges that aren't eligible for a diversion program or an alternative court program. And then there are people that don't have any treatment need. They don't have a treatment need. They don't have a mental illness. And maybe they just were in the wrong place, the wrong time, made a bad decision, right? And that's a whole different story. So there's definitely spectrum. And my world kind of dwells in misdemeanor and felony offenders who have eligible charges that are in need of some sort of treatment that we can help with.
Yeah.
Tammy, it's been 4 years since state question 780 and 781. Can you believe that? I mean, time flies, right?
No.
2 years since 805. And I remember reading a story that you ran where you were saying the voters at 780, 781, it's time for a change. 805, they sent a totally different message. Okay, we're not changing that much. there's also, this is kind of one of those Jeff Dismuke's mega questions. I'll try to, So we have what's going on in Oklahoma County. We're at 76 days from an election. There's still going to be a debate about what that building looks like, what couldn't be done in terms of treatment. So the voters have to do one thing here. I mean, they're going to have to say if they want to change or not, which was what you said 4 years ago about 780, 781, they want to change. So first off, the voters have to decide, do you want to change or not? Number two, when they come down to the discussions about how best to deal with this population, with your experience on what you've seen the last 4 years, I'm kind of putting you on the spot here. What do voters need to be taking into? What's the calculus for them making decisions about this particular building in light of what you've seen over the past few years?
Well, Scott, I think key is as quickly as we can assess the risk to public safety and the treatment needs, the better off we are. Because those that can be released without a risk to public safety or risk of flight, right, failure to return to court, and are in need of treatment, the best place for them to get treatment is outside of the jail. A lot of statistics show that jail is just not a great environment for treatment, but there's a fine line to walk there. For those that do need some treatment, we're not opposed to that, but we don't want, especially those with mental illness, we don't want anybody leaving them in jail because that's a place they can get treatment. Do you see kind of the different, there's a fine line there. And so I think the key is no matter what facility is built, make sure that everybody understands the key is as quickly as possible an assessment to make sure who can be released to the community without a risk to public safety and who is in need of treatment, and then make that connection. Make sure that we have the system to make sure that they're connected to a treatment agency as quickly as possible so that they can start addressing those issues that may have led to their criminal behavior, or certainly led to maybe a lifestyle that required, they felt like they had to steal or they had to do something. So to me, it's all about quick assessment and meeting each person where they are.
If I could just follow up, just one quick follow-up question, which is, does a building dictate how easily it is to do an assessment? Or can a building dictate that?
Can impact it.
Yes and no. The amount of workers also has a big issue to do with that, because they have to bring inmates to do an assessment. So your staffing levels are also critical. Of course, having the space to have that confidential interview, that confidential assessment is key. And maybe we need to look at some innovations. Maybe we need to look at some virtual. We've all gotten used to the virtual world in Zoom, right? So could we somehow use some virtual technology to get assessments done without having to bring someone out of their pod? So I think we need to be innovative and make sure, can we address these in ways with less staffing than it used to be needed, and make sure that there's access for everyone that has a potential to have that assessment and get the right fit for them. So yes, the building can have something to do with it. You have to have that space. You have to have the technology. You have to have, you step back. What do we want to accomplish, and how can we do that in that space?
Jeff, I think Counselor has just offered to help us in this conversation moving forward.
Yeah, I think she has.
Whether she likes it or not. I mean, she is. Tammy, that's great. We really do appreciate that. And because this is a decision that just simply can't be explained in 5 minutes or less. No.
Yeah, it definitely can. And there's so many facets of keeping people safe in the jail, making sure that the people are assessed quickly, making sure if they can be released, that they're released in a way that is beneficial, like not at 2:00 in the morning. I know that does happen, right? That's not good. So there's so many factors. I really do think we can really tap in to the virtual world that we've all learned to live with in so many ways. And how can we use technology to make those assessments, discharge plans, connections with treatment before they ever leave the jail. How can we integrate that technology in a way that doesn't burden the jail staff any further and probably end up reaching a lot more people than we ever could one by one in person? It's just something to think about. I don't have all the answers of how to do that, but I think it's worth exploring.
And this is not coming from a former prosecutor who anybody would ever say was soft on crime.
Oh, absolutely not. Absolutely not. I was pretty tough. My first jury trial, I got 138 years on that offender. And I don't say that to be proud of that. I'm saying there are people who are not safe, who have committed crimes that I think all of the public would say, we don't want them in our community. That's what prisons were. We need that public safety. And so I was not soft on crime, but I also learned to understand, which they never teach you in law school. I learned to understand addiction, pharmacology, the effect of treatment on individuals. And I realized that if we don't treat that underlying cause, if we do not treat the mental illness and have them learn to manage it with the proper medications, treatment, counseling, if we don't treat that addictive behavior and the addiction that is influencing some of their choices, we won't get to the end result. You can incarcerate someone for 2 years, and if they come out without treatment and they don't have tools to manage their mental illness and they don't have tools to stay in recovery, they probably never got in recovery in prison to begin with, but definitely not stay in recovery. What are we going to end up with? We're going to end up with the same triggers, triggering them to use again that they had before they went into prison. And then they're triggered to use, and then they need money for drugs, and they start stealing from cars again. So it's a vicious cycle. And what I saw that cycle change. I saw it change with our diversion programs and our alternative courts, because no longer was the addiction and the mental illness driving their behavior. They had been given treatment and tools and what they needed to live with managing that, so that then they could have a productive life, keep a job, have a safe home, all of those things. And that absolutely reduces recidivism. So to me, I felt like as a prosecutor, I was doing a great job increasing public safety. If all of these people that went through our programs were, many, many, many times less likely to recidivate, if they're not recidivating, that's public safety.
Well said. Well, Counselor, thank you for being with us tonight. I hope this is the first of many discussions as we get inside that, get down to that primary vote. It's not only that, there's going to be people elected to county offices, and sheriffs are going to be running, and prosecutors are going to be running, and it's more than just this jail. So
Absolutely.
anyway,
Always happy to talk about it.
appreciate you very much. Have a great
Thank
evening.
you.
See you again soon.
Thanks,
Thank
Tammy.
you. Sounds good.
Thank you.
Bye.
What a great guest, Jeff Dismix.
Yeah, fantastic. We had two great guests tonight.
Yeah, absolutely.
I learned a lot while we were going through this.
Okay, well, that's the end of our program. You have anything to add to wrap up?
No, we ran a little long. Sorry about the cat fiasco at the start. With live streams are really interesting. I had someone send me a picture once after we had done one with an animal in the background.
It's okay, cat videos, man. That's exactly
maybe that's what I need to move into. That could be my new thing. No, I just appreciate everybody being on tonight. Appreciate being able to talk about it. Man, Tammy was really hitting issues that we needed to be talking about, that we brought up before, and I think she did a great job of really summarizing things and getting out there the resources that are available and that we can take advantage of. And Emily was great with what's going on with the Autism Foundation of Oklahoma. I think that's absolutely a group that more people need to learn about, contact, because I think we all can make a difference with autism across our state.
Well, so great reading. I'd follow up. And I'd asked Tammy about that interview she gave to Read Frontier 4 years ago. Mm-hmm. And it was just very solid then, very solid now. And listening to what she has to say. Also from Emily Scott's interview, that non-doc article, it's good an article I've read recently. Yeah. And Matt Patterson wrote that. It's at nondoc.com. You can read about the waiting list and why it just bedevils the state and what needs to be done. But you can read both of those and look forward to having Emily and Tammy back. Well, it's dinner time, Jeff.
Yes, it is.
All right. We'll see you. I think we're going to do a Saturday morning stream, a Mitchell Talks Saturday morning, mostly because of what happened filing. Don't know who the guest will be, but we've been doing Beyond the Bell on Saturdays. I think we're going to go ahead and stay with those Saturday 10 a.m.s for a while. So look forward to seeing you Saturday right after Hot Seat. I'm not even sure who's going to be on Hot Seat yet. Still early in the week. So for Jeff Dismuke, Scott Mitchell saying, have a great evening, everyone.